Hello and welcome to Aging Well with Dr. Bob. I'm Dr. Bob Flaherty. I'm a family physician and today I'll be discussing changes with aging. Our bodies change as we age and I'm frequently asked, how do I know which changes are a normal part of aging and which changes are more worrisome and need to be checked? In a previous presentation, Changes with Aging Part 1, I discussed some normal changes with aging as well as red flags that need to be checked by your healthcare provider. In this presentation, Changes with Aging Part 2, I will discuss additional normal changes and red flags. The information in this presentation is supported by high-quality medical research, expert medical opinion, and 50 years of medical practice experience. References are given at the end of the presentation. This presentation is for information only. If you have any questions, please be sure to discuss it with your doctor, physician assistant, or nurse practitioner. We all notice changes in our eyes as we age. Normal changes include difficulty with close vision and peripheral vision, trouble distinguishing colors, for instance blue from black and blue from green, and slower adjusting to changing levels of light. Other normal changes include more sensitivity to glare and difficult night vision, both of which make driving at night more difficult. Other normal changes are cataracts and dry eyes, which is quite common. Red flags, things you need to talk to your doctor about, are cloudy vision, difficult focusing, for instance, on faces or reading, new flashes or floaters, and redness of the eye. Serious red flags that need immediate attention are eye pain, sudden vision change, for instance, double vision or blurred vision, and abrupt vision loss, like a curtain coming down. Our ears also age. The normal changes with ears include difficulty hearing high frequencies, difficulty hearing in a crowd, tinnitus or ringing, and since the ears also are involved with balance and not just hearing, we can have normal changes in balance. Red flags related to hearing and the ears are worsening tinnitus, ear pain, worsening balance or vertigo, which is dizziness with a motion sensation like on a merry-go-round or a roller coaster, and very serious is sudden hearing loss in either ear, and that needs immediate attention. Our other senses age as well. Normal changes occur in smell and taste with a decrease that makes food less enjoyable. Decreased sensitivity to touch, pressure, pain can also occur, which can result in increased injuries from burns and cuts. Conversely, increased sensitivity to light touch because our skin is thinner. A red flag is worsening sensitivity to touch, pressure, and pain. Our teeth and gums age, and normally we note receding gums. We also know that meds for allergies, asthma, blood pressure may cause dry mouth. And we're more vulnerable to cavities because of the receding gums and because of thinning of the enamel. And we're also more vulnerable to gum infection. Red flags, which would warrant a trip to your dentist, include bleeding gums and teeth sensitive to heat or cold. A look in the mirror shows that our skin undergoes changes, and the normal changes as we age is that the skin becomes thin, less elastic, more fragile, and has less subcutaneous fat, which results in wrinkles and skin that bruises or tears easily. We also notice, and it's normal, that decreased oil is produced so our skin is drier. And we also develop age spots and skin tags and seborrheic keratoses, which are shown in this image. Those are normal changes as we age and benign. There are some serious changes that can occur on our skin as we age. One is persisting rashes. Others are new or changing moles or dry spots, including changes in color, size, or increased irritation. This man has on the side of his head actinic keratoses, which are red spots and scaly spots. If ignored, actinic keratoses can turn into squamous cell cancer. And we can also develop basal cell cancer and melanoma. All of these require immediate attention. Sex changes as we age. Normal changes for men include more difficult erection and ejaculation and reduced semen volume. For women, vaginal dryness. Both men and women can have decreased levels of testosterone and estrogen, and for both men and women, there can be a decreased interest in sex. It's worth talking with your healthcare provider about these normal changes because treatments are available. A red flag is vaginal bleeding after menopause, which needs to be evaluated promptly. Our immune system also ages, in that our immune system becomes slower to respond to infections and cancer, which increases our risk of getting sick, decreases our ability to heal, and vaccines may not work as well or protect us for as long as expected, which is why we needed boosters for COVID-19 and why a special senior dose of influenza vaccine is available. Conversely, autoimmune diseases may develop, like lupus or like rheumatoid arthritis. Red flags related to the immune system that require prompt evaluation include night sweats in men or in women after menopause, increasing fatigue, and prolonged cold symptoms or cough. Aging changes occur in our metabolism. Normal changes include weight that may go up or down as we age, depending on our exercise level, but we should eventually reach a stable point. Our energy level may decrease, but it should not interfere with activity. And we can still maintain and even increase our strength and fitness with exercise. Red flags that can occur related to our aging metabolism include unexplained or unintended weight loss, for instance, 5 pounds over 4 weeks. Unexplained or unintended weight gain, for instance, 5 pounds over 4 weeks. Increasing fatigue and increased urinating, which can mean diabetes. Yes, our bodies do change as we age, but even though we're getting old, we still need to enjoy life. Thank you for watching this presentation. I hope you found it informative and helpful. If you did, please click like below and subscribe to keep up to date with new presentations. Please note that 2 screens of references follow this screen. Best wishes and age well.